to the Pre-Hospital Emergency Care Council's Cardiac First Response Community Level course. FEC is an independent statutory body with responsibility for standards in education and training in the field of pre-hospital emergency care in Ireland. Its primary role is to protect the public. For simplicity, I will refer to the Pre-Hospital Emergency Care Council throughout as FEC and to the Cardiac First Response Community Level course as the CFR course. As you progress through the course, you will note reference to a number of training resources such as the red card for making an emergency call. Detail of exactly which resources are available can be discussed with your instructor. In my job as an emergency physician, I regrettably have witnessed many patients suffering cardiac arrest. To give these patients the best chance of survival, I cannot overemphasize the importance of early cardiopulmonary resuscitation, or CPR, started in the patient's homes, communities and workplaces. Every 5 years, an international group is drawn together representing medical experts from around the globe. The primary function of this group, known as the International Liaison Committee on Resuscitation, or ILCOR, is to review and make recommendations based on clinical evidence as to how we might improve resuscitation techniques and protocols around the world. While I appreciate some of you may be experienced cardiac first responders refreshing skills, others may be undertaking the course for the first time. Whichever is the case, I would like to walk you through key issues raised under ILCOR's 2010 recommendations. For many years, the primary focus of life-saving first aid has followed the ABC, or airway, breathing and circulation principle. However, with a depth of new evidence, ILCOR have now rearranged these principles to read CAB, or compressions followed by airway and then breathing. In simple terms, the science would suggest that the single most important basic life support intervention is to provide good quality chest compressions. The recommendations that follow will ensure that you achieve this high standard. When making chest compressions, we should aim to compress the chest by at least 5 centimeters for an adult and remain at a third of the chest depth for a child or infant. The rate at which we press the chest for all age groups should be at least 100 times per minute. Modern advances in equipment such as metronomes and CPR feedback devices may assist to achieve this target. Chest compressions are very important, therefore we should cut down on any breaks or interruption to this process. This includes continuing compressions while defibrillators are charging. When delivering breaths to patients, the non-compression time should be limited to no more than 5 seconds. The underpinning principles of undertaking this FEC course is that you will strengthen what is known as the chain of survival. The following illustration represents the essential links in the chain to maximize a person's chance of survival. However, you must also remember that any assistance you may render or any information you receive either from or about the patient must remain strictly confidential and should only be discussed with arriving healthcare professionals. Early access is phoning the emergency number 999 or 112 when an unresponsive person is found. This call will initiate help from the emergency medical services. A responder should also check if an automated external defibrillator is available. Early cardiopulmonary resuscitation, or CPR, is essential to pump blood around the body when the heart stops. It is particularly important to pump blood to the brain to prevent brain damage. Start CPR as soon as possible and keep pressing hard and fast on the chest until help arrives. Early defibrillation is applying an electrical shock to the heart, which stops uncoordinated heart activity known as ventricular fibrillation. The aim is to restore normal electrical activity and thus normal heart pumping. The patient's chance of survival is lessened by 7 to 10% for every minute the person remains in ventricular fibrillation. Early advanced life support, or ALS, involves the administration of medications and more complicated interventions. In Ireland, this is provided by registered healthcare professionals. The American Heart Association chain of survival adds a 5th, post-resuscitation care. In an attempt to make all interventions as simple as possible, FEC has endorsed the principle that for all intents and purposes during resuscitation, any child over the age of 1 receives similar treatment to an adult. Obviously, this will require the use of proportionate force when delivering compressions and/or ventilations to the person. However, more definitive demonstrations will be given during the course. Finally, before we get down to your CFR training, On a more somber note, cardiac first responders must understand that there are definitive indicators of death, and when confirmed, it is inappropriate to attempt resuscitation if any of the following definitive indicators of death are present. Decomposition, where the body has begun to break down. Rigor mortis, where the body has become stiff and discolored. Pooling, when large areas of the body, normally those in contact with the ground, develop a port wine birthmark stain pattern. Incineration, where the body is severely burnt. Decapitation, and other severe injuries which are incompatible with life. In a moment, I will hand you over to Dave Caplice, who will lead you through this course. However, I would just like to use this final opportunity to express, on behalf of FEC, our thanks to you in taking part in this course. Please remember that good quality CPR is the key to survival, and by adopting the skills demonstrated within this DVD, you really can make a difference. I hope you enjoy the Cardiac First Response course, and I will now hand you over to Dave and the rest of the team.